I want to thank Nicole Lamaroux from the National Association of Free and Charitable Clinics for joining us today and helping us understand the role of free clinics in the United States. That's a much bigger job than what we do in just Lincoln, Nebraska. So thank you so much, Nicole, for joining us today.
I'm so excited to be here with you. Thank you.
Before we start our conversation, I want to say how grateful Clinic with a Heart is for the role you play and the association plays in the free clinic playground. You really help us to leverage a lot of discounts, a lot of resources, free resources. We got $30,000 plus worth of medicine and supplies from Direct Relief this year because of that relationship with the National Association of Free and Charitable Clinics.
Oh, thank you so much. I think one of the things that when I started this job, I really wanted to not lose the heart of what free and charitable clinics are, because the work that you all do every day is so amazing, but it's so human. But I also think that the expertise you have is something we can't lose, that we really need to share with our partners and funders and the entire healthcare arena, that you all can answer some really important healthcare questions. So switching a little bit more professional without losing the heart, thank you very much for saying that. That's one of our goals.
Nicole, what led you to the National Association of Free and Charitable Clinics?
Well, honestly, one day I woke up and overwhelmingly had a sense that I wasn't doing what I was placed here to do on this earth. I was very successful in Washington, D.C. at making rich people richer. That's what I did. And I know in our family, it was always stressed to us to honor the golden rule and to listen to where you're being led. And I knew I was not in the right place, but I didn't know what that was. So I called my mom and dad and I said to them, what do I do? And my mom said, well, you pray. That's what you always do when you don't know what you're doing, and we'll pray for you. That afternoon, I went to a doctor for what I thought was a routine mole on my arm, and ended up finding out that I actually, at the age of 33, was diagnosed with inflammatory breast cancer. And my whole life in 13 minutes had shifted from being a healthy young woman making rich people richer to, oh my goodness, what do I do next? And the first thought I had, and I can only tell you that this has to be a God thing, nothing else, was, what do people who don't have insurance do when they have something like this happen to them? Now, I'll be honest with you, I had never thought about an uninsured person before that. I had never had a conversation with who can afford what when it came to medical care before that. In fact, when I had to sign up for insurance, I called my dad to help me. I didn't even know how to do that. So there was a church right across the street from my dermatologist's office, and I just went and sat there. And I called my parents and said, I think that I'm being told to find out something about what uninsured people are doing, and I have no idea how to start that. 2 days after, in the newspaper was the tiniest little advertisement that said, association looking for executive director having to do with healthcare. And when I went home at that time, that was still when people left messages on answering machines. And 5 of my girlfriends said, did you see that in the paper? That's what you're supposed to do. So I truly believe that I was called to come to this job, and I wouldn't have known anywhere else. And it has been the most rewarding and gratifying and humbling experience of my life. And I am so thankful that I learned and listened when I was given that opportunity, because meeting you and working with clinics like yours has shifted every part of who I was. And I know that I'm a happier person for having this job. I know I'm more grounded. And my husband was a volunteer for the NAFC. So I even got a husband out of the deal as well, so it was all great.
What a great calling and what a great outcome too. Yes,
absolutely.
I think it surprises people how many free clinics there are in the United States of America. Tell us a little bit about healthcare access and the role free clinics play in the United States.
Correct. Most of the time, people have no idea that there are 1,400 free and charitable clinics across the United States of America. And annually, we serve 2 million people with 6.9 million patient visits. And I think that's a great idea for people to understand that these are not just concepts or out there of one clinic doing one thing, but rather there is a network across the country that have decided to take grassroots medicine really to its core and its belief that everyone should have access to healthcare. And I think the way that we do that is by communities really recognizing the need in each community across the country. And I think people thought that after the passage of the Affordable Care Act, there would be no more of a need for free and charitable clinics, and nothing could be farther from the truth. In fact, we've grown in numbers. At that time, before the ACA, there were 1,200 free clinics in the United States, and now we're at 1,400 free clinics in the United States of America. We recognize that having access to care is more than having an insurance card in your pocket, that people still need access to medicine, still need access to mental health care. And also the fact that the numbers of uninsured, especially after COVID, have dramatically increased in our country. If 27 million people were impacted by, they all won the lottery, it would be on the news every single day. But we're not putting on the news every single day that 27 million people don't have access to health insurance or a doctor. And that's where free and charitable clinics come in. They step in that gap. They provide people access to care to get their health on track, to feel that they are welcomed members of the community and the society. And Clinic with a Heart and other clinics are giving people back dignity. They're telling them, you are important to us and you should be important to yourself, and let's get your health under control together.
And one of the things we all need to think about is your health and my health are connected, whether we like it or not, whether I know you or not, whether I make eye contact with you or not. Your health and my health are connected.
I think that's such a beautiful statement, because if COVID's taught us anything, we really have learned that. Prior to COVID, I think people really took their health for granted. And now we're being a little bit more thoughtful about how we care for our community and how we care for each other. And that's one of the most beautiful things about free clinics, is that free and charitable clinics have always cared about their community's health, the entire community's health. They talk about access to food and access to transportation and looking at, do you have great living conditions that you're in? Those are all the questions that I think, while the rest of the world is talking about social determinants of health so much, I say that I'm lucky enough to work with you all because you've been thinking about that whole person healthcare all along. And that's one of the beautiful part about free and charitable clinics is you know your patients. You know their needs, not just that's diabetic patient A. That's John. He's a diabetic. Last year he lost his job. He lives here. And this is the care that we're giving him. And I think that makes a big difference.
Absolutely. I also think that people that volunteer or work at free clinics help to transform healthcare in that they see people differently. I know everyone I go to for my healthcare now is a volunteer, just because I know their heart about people is different. They're not about margin, they're about my health and treating me as a human being. And it's made a difference in my own health just because I've switched to those volunteers as my providers too.
Oh, I think that's so beautiful. You know, one thing people never think about is we have a workforce of 220,000 people when we talk about our volunteer and staff workforce in the United States of America. Again, that's a very large workforce. So many of the people in the professional medical field that do this on a daily basis, they got into medicine to care for people. And that's what they wanted to do. So now that clinic has brand new doctors and nurses that are volunteering their time, all because they just hadn't heard about it yet. They would have eventually, but they got a place to do that. But it makes a difference in our health when we care about someone else.
So Nicole, I think a lot of people think the need for what we do is lessening. And you talked a little bit about that the Affordable Care Act, Medicaid expansion in states, is it lessening? And what is the impact of a free clinic on a community? Financial, but also health-wise.
You know, I think that as we look at what's happening in our country, free and charitable clinics will remain incredibly important for years to come. We don't have a public option or a single payer option because policy-wise, right now we're focusing on COVID and getting that under control. I think some of the things that people forget too is that When you're uninsured, you have access to free medication or you have a free clinic that can help you. Sometimes when you transition to Medicaid or other things, you may not have access to that any longer because you may have to pay out of pocket. That is what I think one of the most beautiful things about free and charitable clinics is that we're recognizing that healthcare is not just one physical every single year. We are talking about chronic disease management, and we are talking about making sure you can afford your medicine and you're not making that choice between $4 if you had to go pay it or food on the table. We're actually saying, let's figure out a way to get you healthy. So we're not going to go away because we're recognizing that the need for healthcare is broader than just a card. There's something about building up a community through volunteerism that is completely specific to the work we do that this country needs dramatically.
Yeah. Nicole, I want to go back to something you said. Access and insurance are not the same thing. So a person may flip over their brand new insurance card and call the 800 number and not be able to find a provider. So those are two different things. So do a lot of free clinics see patients who have insurance?
We're seeing that in those states that expanded Medicaid, some clinics have transitioned to a hybrid model. So where on Monday, Wednesdays, and Fridays, they're free clinics in nature. And then Tuesdays and Thursdays, they may see those people who either have too high of a deductible or they can't find a provider, especially in more rural areas. We're seeing that many of our rural clinics are recognizing that the closest provider when they have an insurance card is 100 miles away. Well, that's not really easy to get to. We're seeing that that's starting to be a transition. It's still a smaller transition in the numbers because the uninsured or medically underserved numbers are so overwhelming still, even in those states that have expanded Medicaid.
And they haven't expanded to all services necessarily either. So dental is a service that we're growing and growing, and that's a bottomless pit of need. They may have insurance, but they just cannot find a dentist to take the insurance.
And I think that is an amazing point. Again, that's one of the things I think that the pay for clinics can really learn from free and charitable clinics is your adaptability and flexibility to recognize that something like that we know for a fact that your mouth is connected to the rest of your body. Dental care is the next big conversation that we're going to have when it comes to healthcare. And there is not a policy provision at this point in time on the federal level that's addressing access to dental care.
I was thinking about free clinics last night and that it's always a leap of faith. There's all kinds of leaps you take. I can think of all the why nots, but you take the leap and it happens. And, you know, we've got 700 plus volunteers and we have 7 churches, a temple, 2 hospitals, 2 teaching institutions with teams at the clinic. That leap pays off. And it's been the best leap of my life. It's been unbelievable to see. You see the best in people, like you said. The volunteers are amazing, but patients are amazing when they're interacting with us, too.
I think people should follow your lead a little bit more than be scared, because sometimes being scared makes us be small. And when we trust, it can make a very big difference.
We started our clinic from a mission trip, a medical mission trip that a Methodist church took to Mexico, and that inspired what we are today. You talked about your role being part of a faith journey. Are a lot of free clinics in the United States, do they have that weaving them together that you know of? You may not even have an answer to that question.
Sure. 38% of our clinics are faith-based in some sort of way. And I think that what I'm finding is that the clinics that take that leap of faith and tie that to their actual religion in some sort of way are very vocal that they want other people to understand that whatever path you take, if you actually follow in faith, you will be led to where you're supposed to go. I also think for those clinics that are not faith-based specifically, I'm finding that there is that sense of hope. That hope that I think only comes from a belief in something bigger than who you are and what you do. I think that also ties so many people together. And I will say that our clinics are, you know, whether they're Muslim clinics or they're Jewish clinics, they feel connected to the broader faith-based community. And I think that is one of the things that free and charitable clinics can teach the broader medical community is that you all recognize the need that we're all connected, that in some way we're all connected to make this world better and to live the golden rule and to recognize that we treat others as we would like to be treated. And that connection has brought wonderful partnerships that wouldn't have happened if they didn't just say hello or sat down with somebody at a lunch table at a conference. And there's something to be learned from that.
I think in the last year, many of us have a much more raised awareness about health equity, and COVID has certainly made us more aware too. I mean, even when I look in a line of people getting vaccines, I'm not seeing health equity in those lines. So what does health equity mean to you?
I think health equity means to me and to the broader scope of free and charitable clinics is removing barriers to care and recognizing that it's not just enough to say we're open, but rather we have to start saying we're open and we are welcoming to you to come here. And I think there's a couple of examples, especially during COVID, that some of our clinics have really done that opened my eyes to some things. We had a donor that gave us a great deal of money to turn convention centers into doctor's offices for the day. And what we would do is work with the clinics in those communities if they wanted to, if they had patients time. And we were in New Orleans and there were 2,200 people out waiting to get access to healthcare. And there was a gentleman that came when he was at the sign-up process and he wanted to talk to the lady in charge. And so they found me, and this gentleman came up to me and he was incredibly angry. And he invented bad words, I think, to say to me at the time. And it took a little while for me to understand, but we were saying to the patients, read this consent form and sign it. And in that moment, I realized that I was the person who set up the barrier to care because I didn't stop and recognize that we didn't write it in a way that people could understand, and we weren't offering to read it to them and explain it to them. So thank goodness, again, as only free clinic people can do, we stopped immediately the entire clinic and rechanged our processes, and we were able to give this man what he needed. At the end of the clinic, he came up to me and handed me a bag and said, "Thanks for fixing it, lady. You can have this now." And I said, "Okay, what's in it?" He said, "Don't open it till I'm gone. But if you weren't here and you didn't fix it, that's what I was going to do today." And when I went into the office that we had, a little makeshift office, and I opened it up, and there were 3 bottles of Jack Daniels, 15 prescription bottles, a knife, and a gun. And there was a note that said, "I can't do it anymore. No one cares about me." And I recognized that in that moment, that day, if I wasn't surrounded with people who were truly connected to wanting to make healthcare accessible and equitable, we'd have one less person in this world. Now, fast forward 4 years later, this gentleman now is a volunteer at the clinic in New Orleans, has a wonderful job, and loves to tell his story. And I think that it's okay sometimes if we ourselves stumble or fall when it comes to our quest for equity. It's when we get up and we change and we say, "I'm sorry," when we're sorry, and then we make the difference. We ask for forgiveness, but we change as well. I think that's all we can do when we try to get equity in this country.
Wow, what a beautiful story that is. I know at the start of COVID, my heart broke at closing the door. You know, we were no longer a walk-in clinic and making forms go online, because how in heaven's name will you fill out an online form if you don't have access to the internet and you can't go to the library to get access to the internet? My heart broke at that. But I mean, the step up was the volunteers who said, "We'll call the patients, we'll fill out the form, we'll get it done." And the door was still closed. That part I couldn't solve, but those are hard things when we have to change and we have to see what it does to people. And it also affects our relationship with people, because we were a place you could go get a cup of coffee and hang out before your appointment. Now, hopefully we'll be back to that someday.
I know you'll be back to that someday.
So I'm hearing that there is still a need for free clinics in the United States. Are free clinics getting the resources they need to operate, to keep the doors open, and to provide the care we need to provide?
Free and charitable clinics are amazing at what you can do with so little. I am constantly amazed at how you can find volunteers to offset those items that cost money. But the short answer is no. We're not getting enough resources. Prior to COVID, there was a 20% decrease in donations nationwide that were coming to free and charitable clinics. And then with COVID, at the start of COVID, there was an increase we saw coming to clinics, about, a 10% increase. But as time went on, those numbers really started to level off and then stagnate because people needed their funds themselves. We're not federally funded. So free and charitable clinics receive no money from the federal government at all. And I think that's also one of the things that's very important to understand is that when people look at, well, why don't you just get the government to give you money? Well, we don't get the government to give us money. And there's all sorts of reasons about appropriations and line items that we can go to, but also some clinics prefer to be community-based and connected to their communities. To give you an idea of what we need is recently we asked our clinics to fill out a survey. Unfortunately, during COVID, I had to ask you to fill out a lot of surveys. But one of the questions was, if we were going to vaccinate all of your patients, if you wanted to be a part of that, how much do you think it would cost you to do that? And the request that came in was $22 million is what our clinics needed. And you know what I would say to any person who questions me that? That's a very, very cheap investment because we know that our government is spending so much more than that on vaccines. Let's put some money into the people who really need it. So no, we're not getting the money the way that we need to. But on the same side, the amount of volunteers that we're receiving is overwhelming. And if we put a number on those hours, that's astronomical. For every dollar donated nationwide, it's $5 to $6 in services. That is a return on that investment. That's a very solid investment nationwide. And those numbers are different from community to community. They were probably very different at your clinic if someone donated money to you. But think about that. If somebody said to you, if you give me $1, I'll give you back $5. No, everyone's going to do that. Everyone's going to say yes. So I think there's definitely room for growth.
And the impact's even greater in what free clinics do in terms of keeping people out of the emergency room. That's millions of dollars of cost savings for every community. We think about $2 million in our case, just one free clinic in Lincoln, Nebraska. But across the United States, millions of dollars of keeping people out of ERs.
I was asked by members of Congress to give a rough estimate of what we would need in a year of how much money that was. And it was $2.8 billion that free and charitable clinics are saving the healthcare economy. That's what we're giving back, $2.8 billion. And that was using Congress's numbers. So for some reason, Congress thinks that the cost of an ER visit is $1,384. I don't know where that number came from, but that's the number that they're utilizing. If you just times that times the number of patients we see every single year, and we assume that each one of those patients would go to the ER just once, which is also a very low number because we know if you're a diabetic with chronic diabetes, you're going to be going multiple times. So the low number that we're saving our healthcare system in this country nationwide is $2.8 billion. I think that when we look at that as average people, we can recognize that that's making sure our insurance numbers don't go up, our premiums don't get higher. We're recognizing that there's less people in the ER, so our wait times go down. And let's face it, emergency rooms should be for emergencies. That's what they should be utilized. I mean, they should be utilized for people like me who break 2 ankles in one day, not necessarily someone who really needs help in understanding how they get their diabetes under control and need a longer service. We're a good investment. We need more funds. We encourage people to give more funds, but it's not because we just want the money. It's because we can prove that what we're doing with the funds is making active differences in people's lives.
Clinic with a Heart, our vision in the long run is that we're no longer needed. So our dream is that everybody have access to healthcare, and a free clinic isn't necessary. When you think about the United States, what are the barriers to us as a nation getting to a point where everybody has access?
I think the largest barrier is that we think of people as people, and politicians think of people as politics. And that is the biggest difference. And what I mean by that is we are the only people in the world that are actively trying to put ourselves out of work, those of us in the free and charitable clinic space. However, when it comes to healthcare policy in our country, insurance companies, political action committees, elections that happen every 2 and 4 years, a 24-hour news cycle, Twitter, all of those things impact whether or not we get to a place where health insurance is open to everyone, or that a change in the way healthcare is delivered in this country actually happens. And I think that we have to recognize that we are so grateful for the politicians that are doing the work that they have to do. But we also understand that they are constrained themselves by laws that were written previous to them coming into Washington, D.C., by rules, by companies that may or may not want to change how they're doing business in each of the communities. What's going to have to change is that each and every single silo that addresses healthcare, politics, insurance companies, all of the associations that work with medical professionals, hospitals, private doctors' offices, free and charitable clinics, community health centers, we're all going to have to come together and agree that healthcare needs to be equitable, and we're going to all have to be willing to change. And I think that from my seat in Washington right now, that's not on the horizon because we have so many other things that we have to address at this point in time, like COVID. So I think that immediately what we need to do is make sure that free and charitable clinics continue to be funded, continue to have volunteers, and continue to share the expertise that you're having in the ground so we can impact those conversations in the future.
I think about the impact COVID has had on our clinic in Lincoln, Nebraska. We've pretty much re-engineered our entire operation on a dime. In a month, we changed how we did everything, which is amazing. And actually, most of the changes we made are going to endure. They were good changes. We're going to keep them. We'll, of course, make them better because when you do something in a month's time, there's always room for improvement. When you think about the United States and free clinics, what do you think will be a forever change in the free clinic landscape?
I think the first forever change will be the use of telehealth across the country. 75% of our clinics now have automatically shifted to telehealth, but within a month and a half of COVID, 67% of our clinics had transitioned to telehealth. Just like you said, on a dime, overnight, in a place that we had never been before, and that's not reimbursable in any sort of way. And if you think about the flexibility that free and charitable clinics have had during COVID, I am amazed that transitioning from a walk-in model to an appointment model, or transitioning to an in-person model to a telehealth model in such a fast way, but in a way that makes your patients still feel as if they are valued, is something that cannot be discounted. There is something special as part of that. But a lasting change will be telehealth. We're seeing more and more of our clinics are going to remain in the telehealth model. The uptick of utilizing text messaging capabilities for patients and allowing education to happen on text messaging. I think that's also going to be something that has been a new shift for us. And a lot of those clinics that have turned their parking lots into Wi-Fi hubs for students, we're noticing that they are going to make that part of their regular operating for their locations as well, because they're finding that those students couldn't go to the library. So they didn't even necessarily recognize that it was a need in their community. Those would be the three things, but overall, technology.
Nicole, you talked about telehealth being a way free clinics have pivoted to give more people access, especially during COVID. But what are some other things you see free clinics doing that are innovative or new, unique ways to give people access?
I think there's a couple of different ways that clinics are doing this. First, mobile health. We're finding more and more clinics, even if they have a standing clinic, are investing in a mobile unit for themselves to go out into the community. Also, healthcare with a backpack. We're finding that many of our inner city clinics are actually providing their doctors with a backpack to help those people who are experiencing homelessness in a new way. I also think that health literacy is an entire conversation that really helps with access, and recognizing that not only is a conversation about Spanish or Russian or Polish, but also languages like Farsi. Or in the South, we're finding not just Cajun, but Pidgin Cajun and African American vernacular English, recognizing that language also allows people to have access, and making sure that language is developed in a thoughtful and kind way is another way that we can do that. Not just compassionate healthcare or culturally competent healthcare, but also empathetic and sympathetic healthcare allows people to feel as if I want to go back to Clinic with a Heart.
And one of the things I'm hearing from you is access and relationship are very closely tied together. So there has to be an institutional trust to even want to access an organization. And I think free clinics maybe excel at that more than a lot of other organizations, because we know people who come to our door often don't trust institutions. So we're building that relationship from the first eye contact through the whole visit.
I love what you just said, because so many times people said, well, I could never go there, or I wouldn't fit in there, or it's too fancy if they talk about doctor's offices. One of the things free and charitable clinics do is you slow down time for a little while and you learn from someone, and being a safe space is something that makes a big difference for someone to have care.
I want to say thank you to you, because the work you do in your role at the National Association does elevate and support free clinics in a very meaningful way. So thank you for that.